Okay, this one's heavy, but it's one of the most human parts of nursing. Your patient is dying, their family is sobbing, and your own emotions are on the edge. Now what do? You freeze up, say something awkward, or do you show up like the calm, steady force that you were trained to be? In this lesson, we're going to be diving into grief, crisis, and end-of-life care. The kind of nursing that isn't about fixing, it's about being present. You ready? Let's go. All right, what's our first step in this process? Well, we have to understand that grief is not linear. So let's talk about Kubler-Ross's 5 stages of grief. We start with denial. This can't be happening to me. Anger, why me? And then bargaining. If I could just, and then depression sets in. They withdraw with sadness, and then acceptance, calm, and readiness. So here's an NCLEX tip to remember. These stages, they're not sequential. They don't happen 1 to 5. Patients may jump around, but what's your role? Well, you have to support whatever stage they're in without any judgment. So what's step 2 in this process? Well, crisis intervention. You have to stay grounded in the chaos. Now, a crisis is any situation where a person's normal coping mechanisms fail. It could be a new terminal diagnosis, a traumatic injury, a psychiatric break, or a caregiver overwhelmed by a loss. So what's your job? Well, you have to ensure safety first, psychological and physical safety. You got to use clear, simple communication. You remain calm, even if they aren't. And don't make promises. Example, don't say everything's going to be okay. So what is step 3 in this process? Well, therapeutic communication during grief is essential. But what do you say? I'm here for you. This must be incredibly hard. Would you like to talk about it? Or silence. Yes, intentional silence is extremely powerful when helping your patients deal with this grief. But what don't you say? Well, don't say, at least they lived a long life. Everything happens for a reason. You need to be strong. Or I know how you feel. Trust me, even if you have gone through the exact same situation, you don't know how they feel. Okay? Pro tip, when in doubt, say less and listen more. So now the patient has to decide between hospice and palliative care. But what's the difference between the two of them? Well, palliative care, it can begin at any stage of an illness, and it focuses on symptom relief and quality of life. Can be provided alongside a curative treatment. Now, hospice care, it's for patients with 6 months or less to live. Patient has chosen comfort over cure, and it's covered by Medicare under specific criteria. So here's an NCLEX hint. If the question mentions patient refuses further treatment, think hospice. So now that the decision is made, at the end of life, what is your role as a nurse? Well, it includes pain management. Opioids like morphine are commonly used, even if it may distress respirations. Comfort measures, mouth swabs, repositioning, and a calm environment. Family education, what is to expect during the dying process. And spiritual support, honor rituals, offer a chaplain if appropriate. So what are the signs of dying that you're going to experience? Well, Cheyne-Stokes respirations, molting, decreased urine output, decreased appetite, cold extremities. So here's a tip to remember for your NCLEX. You're not there to prolong life at this stage. You're there to promote dignity and comfort at the end of it. So let's try out an NCLEX question. A client with a terminal cancer tells the nurse, I don't want to do chemo anymore. I'm tired. What is the best response? But chemo might help prolong your life. Let's discuss hospice options when you're ready. You shouldn't give up. Let me call your doctor to schedule your next treatment. Take a moment and write down your answers. In this case, the answer is B. You're respecting the autonomy and gently introducing appropriate next steps. So here's a nursing gold nugget to remember. Sometimes the most powerful thing that you can do is sit quietly beside a patient and let them know that they're not alone. So just remember that this work is sacred. Helping someone through the end of life takes more than just knowledge. It takes heart. So next up, we're going to talk about abuse, neglect, and mandatory reporting, because nurses are mandated reporters, and sometimes being a patient's lifeline means knowing when to speak up. Great job on that section. Go do your exercises. I'll see you right back here for the next video.